more lateral from line 2. Now that means that line 1 is on an angle here. Line 2 is virtually straight down the outside of the leg. Literally, we have a landmark, which is the IT band, which is that hard, ligament, all right, on the down the center of the outside of the leg. And then line 3 is on the low side of the outside of the leg. Now, the angle of pressure, whenever I put pressure or I focus energy or attention on a line, is always toward the center of the body part. And so that's a rule, okay? Toward the center of the body part. So I imagine that the leg is round. Really, it's not really round, right? It's just more round than it's square. But I just visualize that it's round. So if line number 1 is here, when I put pressure on line number 1, I'm aiming toward the center of that circle, of that round leg, where I hypothetically visualize the center. Now, what's in the center of the leg? Not exactly, but for argument's sake, yes?
Femur.
The femur, the bone, right? What's in the center of this mass is the bone. Well, why am I focusing energy? No matter what line I'm working on, I'm always aiming at the center, and what's in the center is the bone. Why am I aiming and focusing energy on the bone?
Hollow?
Well,
Pushes back.
because the skeleton is the primary highway or course of energy transference in the body. And it is where our life force is primarily concentrated and is primarily distributed through the body. That's the theory. Not the skin. That's superficial. Okay? Not the soft tissue. That's superficial. The core of our life force is transmitted through the bones. In Chinese medicine, that's called bone marrow chi. See, you can have deficiency in every kind of chi, liver chi, spleen chi, kidney chi, heart chi, pericardium chi. You can have deficiencies in excess in all of those, and you can still kind of pretty well get along and survive. You have deficiency in bone marrow chi, and the acupuncture doctor is taught to make the client comfortable, inform them that their life is soon to end, and try to keep them as comfortable as possible until they die. Because, yes.
How would you identify bone marrow chi as a doctor?
Yeah, can't tell you now. Don't have enough information. But basically, I do the assessment for it, and it's either plus or minus, and that just tells me. But all symptoms of life, okay? But it's fundamental, it's the most core, and in yoga we say that's the Kundalini Shakti that is directed and transmitted through the skeleton, okay? A lot of people will talk about the spine, particularly, but, guess what? You have more energy by volume being transmitted through all the rest of your bones than you do in the spine, okay? In fact, the largest vessels of energy in your body actually are the femur, or the leg bones, by mass, okay? And also, if you think of it another way, your vital life force, that's actually the immune system. If we were to take it from a Western point of view, what is your vital life force? What is the intelligence of your life vitality? Well, it's actually your immune system. And the immune system factors, all of the lymphocyte killers, all of the T killer cells, lymphatic fluid, and so on, are produced in the bone marrow. And so the inside of the bone is alive. And its job is to keep you alive. It's producing all of the factors that protect you from every kind of harmful influence that you'll ever be exposed to in your life. And it also has a memory function, right? Because the psychoneuroimmunologists talk about that if you were ever exposed to any infectious agent at any age of your life, that the memory and response to that infectious agent is forever in the system, that you never forget it. That if you got an infection from a particular bacteria when you were 3 years old and you produced an immune reaction to that, an antibody to that, you have the capacity to produce the antibody the rest of your life. And it's present in your system. So there's actually a long-term memory effect that's associated with the immune system as well, which I find fascinating, okay? But so when we work the energy, even though we're working nadis and the superficial energy lines, we're always focusing toward the center of the body part, which is where the bone marrow chi is. And all systems, all traditional oriental systems of energy cultivation emphasize the bone marrow chi. Okay, emphasize the bone marrow chi. So in China, that's what Tai Chi is. That's what Qigong is. They are systems to stimulate the bone marrow chi. That's what they are. Okay, and then what do you do with it? You direct it to the organs, and then after you direct it to the organs, you direct it to the extremities, and after you direct it to the extremities, you direct it to your neighbor. But it comes up from the bones to the organs, to the tissue, and then to you. Now we can give it back and forth, right? In yoga, another definition of Hatha yoga is it's a system of bending the bones. Okay? And so when you do postures, when you do asanas, when you bend forward and backward and you twist and pull and push, you actually create enough force to subtly torsion, twist, and strain the bones. And the way the bones produce the healthful factors that their job is to produce, what triggers that? What triggers the bone to produce these things is actually stress on the bones. Stress on the bones. So the number one cure for, say, bone loss, like osteoporosis. Osteoporosis is actually caused by sedentary lifestyle, bad nutrition and sedentary lifestyle. That's what causes osteoporosis. The cure for osteoporosis is to clean up your diet and get moving. You have to stress the bones. When the bones are stressed, they recruit calcium out of the soft tissue and blood into the bone. When the bones are not stressed, whatever is more stress, i.e. the soft tissue now is more active than the bones, then the soft tissue recruits the calcium out of the bones into the blood. And so you end up with high levels of calcium in the blood and lower levels of calcium in the bones. But you take that osteoporotic individual and you have them start doing yoga, okay? After a year, not only do they have greater bone density, but they have less calcium in the blood, less calcium in the soft tissue. And just changing activity level alone will do that. No Tums, no calcium supplements, no whatever. In fact, worst thing you can do if you have osteoporosis is take calcium. Worst thing you can do. Don't do it. Well, because your metabolism is upside down. You're already in a metabolic state where your soft tissue is leaching calcium out of the bones into the blood system. So it's not about whether you have calcium or not. In fact, if you test the blood in someone who has advanced osteoarthritis and so on, if you test the blood, okay, osteoporotic, they have high levels of calcium in the blood. In fact, the more advanced the osteoporosis, the more calcium you see in the blood. But you also will see it in the soft tissue and the muscles, right? So it's not a calcium deficiency. So taking more calcium is actually not going to change it. The pyramid's upside down. You need to get the calcium that's already in the system out of it and back into the bones. The mechanism that draws calcium from the blood into the bones is actually stress. It causes a polarity switch in the electrical potential on the surface of the bone. It actually changes polarity, and that's what pulls the calcium out of solution into the bone. Okay, it's actually a stress reaction. If you look it up, it'd be under the piezoelectric properties of osseous membranes. Piezoelectric properties of osseous membranes. Calcium has an electrical charge, and what determines whether calcium is pulled in or repelled from the bone is the superficial electrical polarity of the bone itself. When you bend a bone, it actually changes from positive to negative. When you bend the bone, it has a piezoelectric effect. We were talking about Marcel Vogel the other day. Who was that? Who was talking about Marcel Vogel? Who was my Kabbalah teacher, all right? One of the things he was world famous for, and he was also nominated for the Günter Loescher Award in physics, was because when he discovered the piezoelectric effect, which is that if you put physical pressure on a crystal, it generates electricity. If you actually put physical pressure on a quartz crystal, compress it and or hit it, like literally take a hammer and whack a quartz crystal, it actually generates electricity, a DC electric potential. The polarity of the crystal changes under impact and or pressure. So if you take a long crystal and you put a positive, you put one wire on one end and one wire on the other, just literally, just tape them there so the bare wire has contact to the crystal, and you have a very sensitive voltmeter, all right? The crystal at rest has no voltage. It'll have 0 voltage. If you take that crystal and you put it in a vise and you add pressure to the crystal, it will actually generate electricity. All right? That's called the piezoelectric effect. Marcel Vogel discovered that. So he actually, not only did he discover that, he found out that if you whack it, if you give it a little pat, hit it with a hammer, like literally thump it, that it generates enough DC electricity to produce a spark. Okay? Every piezoelectric lighter and grill and stove in the world now that you push a button and it goes click and the flame lights, it produces a spark, is based on this principle. All right. Now, what was really interesting was Marcel Vogel discovered that property about crystals. Dr. Robert O. Becker discovered that he did the same thing with a bone, with a femur, was the actual experiment, and he found out that when you bend the femur, when you flex it, when you put strain on it, the bone itself actually produces electricity. And they call that the piezoelectric effect. Further investigation found out that part of the structure of the bone is the mineralization in the osseous membrane. So the bone actually pulls copper and barium and other kinds of metals out of the blood into it, along with the calcium, salt. Calcium is a salt, by the way. And so salt is a crystal. Calcium has that capacity, along with other metals, that when the bone itself flexes, it produces a DC electric potential and it changes its polarity. All right? That change in polarity is actually what determines the activity of the bone. All right, go ahead.
What are the factors that make the bone start losing calcium?
Lack of stress.
Okay. So it's not anything else?
Lack of stress,
That's
lack
the
of
one
activity, load bearing, lack of stress, sedentary lifestyle, spending the bulk of your day sitting, laying in bed, being sick.
You mentioned diet too?
Diet exacerbates it, but it's not the cause.
Oh.
Okay, the cause is non-load bearing activity. That's the cause. And see, there was no such thing as osteoporosis before the turn of the century. It's completely a modern disease. There was no such thing as osteoporosis as a condition until the 1950s. Okay, no such thing. And the reason why is pre-1950s, 99% of all people did physical work as a way of making money and making a living. There was no such thing as you could sit in a chair all day and make money. You know, for most people, 90%. You had to actually lift something. You had to carry something. You had to push something. You had to pull something. You had to, you had to do some work to make a living. And so there wasn't in the population diseases based on not doing anything.
Why is it more common in women?
Because women do less load-bearing work than men do. It's fact. Women do less menial jobs, less hard labor jobs than men do statistically. Now, I know you might say, well, but women can do any job, a man can do blah, 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 but they just don't happen to.
What
You know,
about
it's
childbearing?
well, so you have some effort for a couple of days.
Well, I mean, that doesn't suck out calcium out of
No.
our body.
No, actually, there are no adverse health effects of being pregnant and delivering babies as a general rule. If you're healthy, being pregnant, you're just more healthy. Pregnancy is not a disease, so there is actually no negative health consequences of being pregnant as a general rule. Okay, again, that's a myth. American medicine has made pregnancy out to be a disease, and that's why doctors are in charge of it, okay? Because they're in charge of disease, okay? And that's why you go to the doctor when you're pregnant, okay? That's the whole system is based on that. In other countries, pregnancy is not considered a disease, and so you would never think to go to a doctor just because you're pregnant.
And you're out on disability.
Yeah, there's no such thing as a pregnancy disability. Other countries, like in other countries, there is no disability for pregnancy because it's not considered a disease. There's no disability of being pregnant. You know, if you're doing heavy physical labor, there may be at some point work that might not be appropriate for you.
Right.
Okay, but it doesn't mean you're disabled. It means you accommodate how you feel. Just like when you have your period, you're not disabled. You're just having your period. So there are just some activities that might be more or less appropriate, right?
Mm-hmm.
But you're not disabled. You don't need to go to a doctor every month because you're having your period. Oh, I'm bleeding. I have to go to a doctor. Okay, no, that's crazy. Okay, all right, but now let's go on. So the bones, another way of defining yoga therapy, okay, is yoga therapy is basically systems of stressing the bones and bringing stress to the bones, the manual therapy. And the herbs and medicines actually support that process. And remember, all herbal medicine is enhanced nutrition. Okay? That's all herbal medicine is. Try not to think of it as like something separate. So when I say diet can be helpful, I'm also including herbs. I'm also including natural medicines and things like that. Because for me, they're just food. It's just more specific food. Okay? Okay. All right, great. All right, now, so come close, just so you can verify these lines. And I don't want you to get hung up on the lines too much because remember, a nadi is not like an acupuncture meridian. It is not this exact little line here. In fact, in the ancient Thai literature, which I will show you, actually I'll show you because I actually have some very good high-resolution scans of original manuscripts showing the Thai lines. They're not very precise. They don't even have the right number of ribs, you know? So like when they show the ribs and where the points are, you don't get all hung up on it because they're not going to have 12 ribs. Some of the drawings, they have 14 and some they have 10. They don't even have the same number of ribs from drawing to drawing, all right? There's another reason for that. But here's line number 1. If her foot's turned straight up, it's just off the center line. So it's not on top of the leg. It's the width of the thumb lateral of this imaginary center line. The highest point is the first soft spot off the hip. The bottom point is aiming to the top outside corner of the knee. Okay? But main thing is lateral leg. It's on the outside of the leg. If you're over here, then you're not in the right place. All right? Now, if this is line 1, then the length of my thumb from base to the tip, look, there's line 2. Okay? That means line 2 is about down the straight outside center. See, she actually has a seam on her pants right there. And that's about where line 2 is. And if you push in here, it's hard and it's sensitive. Right? It's hard and it's sensitive. That's at most male line. Okay, that we talked about in the sideline position, it's the same. And line number 3, again, the length of my thumb, lateral from line number 2. If I hook my thumb up a little bit and draw a line, there's line number 3. Okay, line number 1, I aim in at this angle. Line number 2, the pressure goes straight in this angle. Line number 3, it has to go up on this angle because I'm always bringing energy toward the center of the body part. Doesn't matter leg, foot, arm, hand, belly, chest, back, butt, head. I'm always aiming for the center of the body part because that's where the primary energy is that I'm trying to establish communication with. Now, the technique here is called a reinforced rolling thumb. One thumb on the line or the point, and there are 5 points on the line. 5 points. They're the length of the thumb apart. So if this is number 1, okay, and let's say here's my thumb, so it goes like this: 1, 2, 3, 4, 5.
But it would be her thumb, right?
Yes. Yeah, and I don't have to keep saying that. All right. Anytime I say a dimension, length, width, height, step, stride. It's always relevant to the client's body. Never mind. I always adjust what I'm doing to compensate for difference. So for example, I know that my thumb appears to be a little bit longer than hers. Okay? So when I'm talking length of the thumb, I'm not talking about my thumb, I'm talking about her thumb. Right? Okay. Now, so I'm going to work those 5 points. Now the first one, I'm going to turn my fingers out. It's a reinforced rolling thumb. One thumb on the point, the other thumb on top of it. Okay? Arms are straight. Because to get pressure, I lean. That's how I create pressure on my thumb. There's no squeezing. There's no motion on the thumb. The first point or two, I'm going to hold my hands like this so I don't have to jab her in the groin. Okay? But as soon as I'm past worrying about putting my fingers into her groin, then my hands come together because I want my thumbs under my hands. If you're doing this rolling thumb correctly, you should not be able to see your thumbs. Okay? And the reason why is because the thumb to be centered on the center line of your arm, remember I have that same bone marrow, primary energy moves to the center of the body part. I'm trying to see my thumb as an extension of that. I want my thumb to be on that line too. If my thumb's over here, here's the bone marrow chi coming through my arm, and it's impacting the leg over here, but I'm thumb pressing over here. All right? So my chi's over here, my thumb's over here. The only way my thumb can compensate, because here's where the chi's coming from, is with muscular strength. I have to compress all this musculature to compensate for the deviation from the center of influence of my energy. Now, when I get my thumb, here's where the energy is going into her leg, actually in line with the energy I'm trying to give her. See how that looks quite different, okay? Well, actually, that is the strongest thumb technique I can possibly do. I can stand on that thumb. If I stand on this thumb, I'll dislocate it or I'll sprain it, because it's all about the muscular strength, not about the actual structural, skeletal, and energetic support. All right? Now, you're not going to get this thumb down today. If you practice, I'll test you on it in about 6 months. Okay, if you practice, I'll test you on it in about 6 months. Because if you practice, that's about how long it takes to get comfortable to do this and really to do it correctly. So all I want you to do today is just thumb press, nice and easy. And it's 1, 2, 3, 4, 5. And the last point, stop just above the outside corner of the kneecap. All right, now, line number 2, just drop down from line number 1, the length of the thumb. The length of the thumb. And it should put you almost exactly in the center of the outside of the leg. Now, of course, are the dimensions different on someone who's grossly medically obese?
Yes.
Yes.
Yes. It may be longer than the thumb. You know, in other words, if the body mass is 8 or 10 times what it should be, then this dimension will not be uniform and proportional according to the length of the thumb. It's not. These dimensions are only valid considering that you're within some reasonable range of being relatively healthy as far as your size and weight ratio and all this kind of thing. Okay? So if there's too much difference, then go with the more general rule, which is off the center line, there's line 1, straight in from the outside, there's line 2. And if you can't, and if it's too big for you to go with the thumb rule for line 3, here's a nice easy way to do it. Put your hands on the mat, slide them, if the toes are straight up, put your hands on the mat, slide them forward till you run into the leg, and then push up and in, and you're on line 3. Okay, so that's another way to do it. Now on 3, I'm using a different technique because it's really hard to roll the hands back out of the way to push up on line 3 when I'm sitting up in front of it. Okay, very hard. The Thais can do it. I'll show you a video of some Thai classical dancing sometime where the Thai classical dancers go like this and their fingers lay over to their forearm. Okay, and they practice that technique since they were children. Right, since they're babies. And actually, Pakur Samai could do that. He could bend his wrist back and touch his fingers to his forearm. okay? I can't do that. See, I wasn't raised from childhood flexing my arms back like that, okay? So what we do as tight Americans is the opposite. Turn your hands up. Pretend like the strong hand, if you're right-handed, the first two fingers on your right hand is your thumb. Support them with your other hand. Go on the floor, slide up till you touch the leg, and then I take those first two fingers and I push them up, and see, there's my pressure on the point, okay? 1, 2, 3, 4, 5, okay? Now just do one line, one time, 5 points. Now, come to the knee, and think of the kneecap, we call it the patella. Think of it as being rectangular, okay? It's actually not really rectangular, but it's more square than it is round, okay? It does seem to have edges, and it does have, you can find corners, okay? All right, so looking at the patella, can I put your pants up? You think it'll go over your knee?
Oh, more pants.
Stop.
Okay, all right, so let's look at her kneecap here. All right, relax your leg. There, see how it has a little motion? Okay. Top outside corner, that's point number 1. Top inside corner, that's point number 2. Bottom inside corner, that's point number 3. Bottom outside corner, that's point number 4. If I mark the two bottom corners and put my thumb right in the middle, that's point number 5. Now, if I'm doing this correctly, point number 5 should be dead center in the middle of the patella tendon, okay? If I'm doing this correctly. Now, here's the tricky part. The actual points I'm working, you can't touch because the patella is in the way. The actual points that are the acupressure points, where the marma are, is you have to displace the patella about the width of your thumb